Now, it is Wednesday morning, and that means that Gabriel McSharry, medical nutritionist and herbalist, is in studio. And if you have questions for Gabriel, you can start sending them in to us now by text, 2083 3500 530, and you can call us at 0818 365 500 with your medical queries. And Gabriel, what are we going to start off with today?
We'll start off with sinusitis. It was a question that came in a couple of weeks ago, and we didn't get a chance to cover because it takes a little bit of time. But so we'll start with that one. It's a common one. An estimated 1 in 8 people in Ireland suffer from sinusitis of some form. For some, it can be quite mild, and for others, it can be quite debilitating. A lot of the time, antibiotics are prescribed, and despite constant treatment, many people's sinusitis continue to return. And interestingly, some research published in the Journal of the American Medical Association in December last has confirmed that antibiotics and nasal steroids are ineffective for the condition. So it's very much something that people find it hard to get relief from, and they tend to go in a natural route just for answers. But just a bit of background to it. It can be acute or it can be chronic. So acute is something that is just there for less than 30 days or so, and chronic sinusitis is something that can be with you for over 90 days in a row, and it could last for months or years even if not addressed. And the symptoms vary, depending on the person, the symptoms can be like runny nose, nasal congestion, thick-coloured nasal discharge, cough, headache, post-nasal drip. So that's like if you get a kind of a drip coming back the back of your nose down onto your chest or down your throat. Facial pain or swelling, so generally pain around either side of the nose and in the cheekbones, toothache, fatigue, fever, and diminished sense of smell and taste. So it can be some or all of them symptoms can kind of signify sinusitis.
Well, some people get it only if they have a cold, though. Or do some people get it by a cold?
For some people they get a cold and then it comes on, but mainly the infection probably goes into the sinus cavity, and it occurs there. So how does it occur? Sinus infection occurs when the mucous membrane in the nose and the sinus becomes irritated by a cold, allergies, pollutants, exposure to dry or cold air. So all these things can be linked to it, and it leads to your membranes to become inflamed while stimulating your mucoid glands to secrete more mucus than usual. So as mucus accumulates in the sinus cavity, it can easily become infected. But that's all on the surface. All infections in general, including sinusitis, appear when certain health principles such as healthy eating, dealing with stress and taking time to relax and so on aren't followed. So this dampens the strength of the immune system and allows bacteria, virus, fungi, whatever, to take hold in the nose and the sinus. And when it does, you can be left battling fatigue, sinus pressure, post-nasal drip, and so on, and difficulty breathing. And definitely at night time, it can be worse because, if you have difficulty breathing through your nose at night, it could keep you up. Because
that's even annoying, like if you've got a bad cold and you think, or you feel like you can't breathe through your nose and you're kind of trying to breathe through your mouth. It's very uncomfortable.
Yeah, because generally we're nose breathers, and because if you breathe through your mouth all the time, and many people with sinusitis tend to do that in their sleep, your mouth dries out, so it can kind of lead to sore throats and stuff like that as well. So something that's where it goes through your sleep, it can affect sleep, and then that affects overall health. So how is it treated? So for acute sinusitis, like a herbal formula like echinacea in combination with elderflower and golden seal, I find really good. And it can enhance immune function and fight infection, and also has antiviral, antifungal, antibacterial action. So whatever kind of infection gets caught up in the mucus, and it'll also break down the mucus in the upper respiratory tract. So that's the acute version. Chronic sinusitis is a bit more complex, and a lot of people end up having surgery for it, but it tends to reoccur. And there was a study done in 1999 where the researchers discovered a fungal organism was present in the mucus of 96% of patients that did the surgery on. So could possibly be the fungus causing the inflammation, and if so, like there's fungus and mold spores in the air all the time, and we all inhale them, and if for some people that's fine, nothing happens, but for people with sinusitis, they can have this kind of overreaction of the immune system and produce lots of mucus, and so it can be linked to fungus. And with that, if you have that kind of overreaction to fungus, it can be linked also to an overgrowth of fungus in the digestive tract. So here's where it can be strongly linked to diet, so I'll come to some dietary things, but in treating overall chronic sinusitis, herbal medicines work great, and I use antifungal herbs, but also will have an effect in the digestive tract, and mucus membrane tonics, so anti-catarrhals. Catarrhal is the build-up of mucus, so anything that breaks down that can break down the blockage and enhance breathing, and that can help also for the immune system, and anti-inflammatory herbs. So kind of a combination of all these can have quite a beneficial effect. A few dietary things: I'd avoid eating too much sugar. So again, like a lot of sugar in the blood can feed fungus. They're anaerobic.
Yeah, sugar seems to have an effect on a lot of conditions.
Yeah, well, I think I quoted before on the show that sugar in a trial, people on high sugar diets had a 50% decrease in your white blood cells, and your white blood cells are a component of your immune system. So I suppose you can translate that into a high sugar diet cuts your immune system in half. If you're on a high sugar diet, you're going to be more susceptible to infections or colds or whatever's going around. You're going to be more susceptible to it because you're just lowering your immune function. Also in particular to fungus, like fungus are an anaerobic microorganism, so they need sugar to feed off, and when there's high sugar in the system, blood sugar, you get more fungal infections. So people with diabetes who tend to have high glucose levels in the blood are more susceptible to fungal infections, but people in general with high sugar diets are also more susceptible. So I definitely take that into account when treating it. Reduce the sugar big time, and stick to more natural sugars. Also a fish oil or cod liver oil can be very beneficial. Again, you have your omega-3s, DHA, EPA, and they're essential for immune function. Then more specific foods, there's foods that contain mycotoxins. Now mycotoxins are toxins that are created by fungus to protect itself. So they're how